All right. Okay. I see you're here at the doctor's office because, we seem to have lost your file. You're gonna have to tell us, everything wrong with you, okay? The nurse will be in a minute. I mean, the doctor. I'm the nurse. What did you say your first name was? And how do you spell that? Okay, okay. And can I get a last name? Oh, haven't heard that one before. Where are you from? Scandinavia? Oh, those guys have a host of health issues. No wonder you're here today. DiGiorno. Weird name. Alright, and could I just get a quick picture of your health insurance card? You don't have health insurance? Give me your wallet. Oh, it's this card, buddy. Yeah, just this flimsy piece of plastic that if you lose, we would have just let you die or anything. Silly boy. Or girl. I haven't asked you that question yet. Alright. And, is this insurance card, are you the holder of it? Okay. This is really bad insurance, by the way. I'm gonna be honest. The front desk told me that we're actually gonna not be helping people with this insurance after this month, because we don't get paid enough. Blue Cross Blue Shield, yeah, no, they pay us bottom of the barrel for our billable rates, so we'll see what we can get taken care of today, because you won't be back here. Alright. And do you have a history of any family health problems, diabetes, gout, lung issues, cancer, high blood pressure, weird urine, any skin conditions, tummy issues, kidney issues, icky liver, smelly, tummy issues? Okay. Well, you eat fruits and vegetables, right? Oh, well. I don't know why you're here complaining of tummy issues then. You should be at the grocery store. No, we don't care. Everyone has tummy issues. Have you been to a public restroom? And, alright. I'm just gonna need your first and last name 2 more times. And can you spell that? Did you know your face is not symmetrical? No. It's pretty common. Pretty common. Hambo DeGorno. Thank you. Alright, so you got tummy issues. What else has been bothering you? Warts? How long have you had these warts? Your whole life. Well, some people just have those. What else? Your throat burns after eating? Okay. I wrote that down. And let me just really quickly take your blood pressure for you. I'm going to put this around your arm. You might hear your heartbeat in your ears for a second. Okay. That's 220 over 120. No. Most people have that. Just think of it like golf. The lower the better. But not too low. The doctor will answer your questions. I also see that you wear glasses. When's the last time you've been to the eye doctor? Oh my God. Okay. Your eyes are like red. Don't worry, I'm just taking notes for the doctor. She'll be right in. And okay, just go ahead and step on the scale for me. I mean, you can take your shoes off. I don't think it's gonna make much of a difference. Okay. Okay. I've got that noted. I'm just gonna write down here. Drug-seeking behavior. Patient is difficult. All right, the nurse will be right in. I mean, doctor, I'm the nurse. Hi, I'm Dr. Feel Better. I'm here so that you can feel better. Now I'm looking here at your chart, and if you could just tell me everything wrong with you. We don't like to... Sometimes the nurse writes things in wrong, so if you could just say it directly to me a second time. Your tummy hurts? Okay. How long has your tummy been hurting for? Oh my gosh, that's terrible. And your mom had this too? Well, I hope she's doing okay. She died? Did she have any other health conditions? I see. Alright, well, I'm just gonna take a look at you here, okay? Say, ah, wow. Oh my God. Don't mind here. I'm just gonna press down on your tongue a little. Don't gag or I'll have to start over. Wow. Wow. Oh my God. Whew. Bring the intern in here. Oh, okay. Oh God, that reeks. No, I'm not being rude. It's a medical term. It medically reeks. All right, now I'm just gonna check your ears real quick, okay? Let me just find my ear checker. Where is it? You weren't messing around with my stuff earlier, were you? Okay. You laugh, but I have lost more tongue depressors to patients, and honestly, my nurse is stealing them than you would ever believe. Okay, well, I can't find my normal one. We'll use the old-timey one. All right. I'm just going to check your ears real quick, okay? Do you hear that? Oh, that's weird. You shouldn't be able to hear that. That's not... Okay. Okay, just go ahead and raise your hand every time you hear the noise, okay? Okay, I didn't even do it that time, so I know you're lying. Ah, you almost got me. Patient almost got me. Wait, that's a foot? Oh, don't worry, I'll put that thing down. I'll be checking your knee reflexes in just a second. Huh, alright. Now, don't mind me. I just noticed when I was checking your ears that you have a little hair right here. Oops. Much better. Hold still. Let me get the other side. You're uneven. Oh, don't mind me. Ah, now that's a handsome insert species here. Okay. And I'm just going to check inside your nose, okay? Oh, sorry. Grabbed your chin. Is it usually this color? This is not a healthy color. We have a saying in the medical field. Blue is bad. Just because it's generally not a healthy color. Okay. Dr. Rocket, patient in the ER with a bottle stuck in him. We need you in surgery. Oh, we're going to have to hurry this up. I make way more money from that thing than this. Oh, Cinder got fired from our practice a few weeks ago. Was kissing the patients. Which we can do, but not as much as he was. You'd like a kiss? Don't tell anyone. I'll get fired. Alright, now I'm gonna just move your head around a little from the back, okay? Oh my gosh. It's like mostly empty. Do you hear that? That's your brain bouncing around on your skull. We don't like to hear that. Oh my gosh. This is like the worst case I've seen. Alright, let me put you down. Alright. I found some mustache hairs too. I mean, okay, we don't have to call it a mustache. I charge $200 for this. Your insurance will probably get it down to $50. Alright, let me just write this down. Patient has fluids throughout base of skull. Regular. Blue discharge coming from patient's nose, comma, smelly. Patient is unkempt and unable to take care of themselves alone, period. What else? Oh yeah, your tummy issues? Yeah, patient complains of discomfort after eating. We can give you medicine for that. Would you want that? You would? Okay. Well, I will write you up a script for that. Now, when you go to fill this at the pharmacy, there's a label that they are legally required to read to you. Don't worry about it. Oh, no, just about 1% of people will develop a life-threatening condition from taking this medication. It's more likely in your ethnic group, actually, but how do I put this? 15% of people will develop an addiction to this medication. Do you have a family history of addiction? Oh. Well, an uncle's not really close family, is it? Alright. Yeah, I think around 100 oxycodone should be good for your tummy issues. Oh, is your father? Well, the gambling issues are really transmitted in the egg. So, unless your father put an egg inside your mother, it's not really anything to worry about. Oh, and your twin brother? Well, he's probably the evil twin then, so nothing for you to worry about. You should worry more about taking care of your appearance. That hair was getting curly. I did leave you a little bit uneven. I hope you don't mind. You do? Okay. I'll put that in your file. Okay, so yeah, the medication, I'll give you a 6-week or 6-month supply. I forgot what I put. Whatever the pharmacist says, you can just kind of let your mind go blank as he reads the warning, because it doesn't. 1%, 15%, these are low numbers. Medically speaking, something is like worrisome when it's about 86% of patients, which you have to imagine you flip a coin and then you keep flipping that coin. If you flip it around 8 times and you get all heads, and we will not be seeing you again because you're one of the lucky 1%. But when was the last time you flipped a coin and got heads 8 times? Now, this will interact with your other medications, which, we should really get an updated list. Could you tell me the medications you're currently taking? Any gabapentin, any statins, any Tylenol? omega-3 gummies, zinc. You do take zinc? Okay, how much? 50? And what are you taking this for? It's not really for that. Okay, anything else? The blood thinners are important. Any neurological medication? Any diabetes medication? Do you have that? Do you have the beaties? Because you should be at a whole different practice if you have the beaties. Also, when you turn 30 next year, we will be unable to see you. This is strictly a post-pediatric internal medicine hospital wing. Yeah, so once you turn 18, we like to have you for about 12 years. And that's just because, usually 20-year-olds have a bit different health issues than regular adults, don't they? Have you heard of hand, foot, and mouth disease? I thought so. Lots of G fuel. So that's caffeine. So you think maybe that, maybe your burning after eating might have to do with the 200 milligrams of caffeine you drink right with that meal? No? Hand, foot, and mouth is what the doctors call it, but you get it from putting things that don't go in a mouth in a mouth. It's common among children, and also not children. Because sometimes people like sticking everything in their mouth. Flashlights, remote controls, doorknobs, just filthy things. You have rabies. Well, have you heard of a bucket list? Or palliative care? Because you won't be with us much longer. And I'm not talking about because we're not taking your insurance starting next month. If it wasn't meant to go in the mouth, then it shouldn't fit in my mouth. Patient is high risk. Okay. So you're taking a lot of medications for someone in their 20s. And also, you're not really supposed to be on this many antidepressants. Usually a doctor will take you off one before starting the next, so that you don't die. He hasn't discussed that with you? Okay. Well, maybe you should bring that up at your next appointment. Oh, I missed a spot. Welcome in, Aldo Aguilar Govela. You might want to come back here soon. I see some lesions on your skin that look irregular. No, I can't look at them now because on your patient intake form, yeah, let me get your patient intake form. Right here, you wrote tummy issues, and you didn't write skin lesions. And so you see that I can't help you with those, right? Because you didn't put it on your intake form. Yeah, right here. Yeah, no, we really can't. Not at all. No, but nothing to worry about. We have another opening in probably 3 to 6 months where we can get you in to look at that. Now, our practice is currently undergoing a bit of a change in management, so you might not see me here in 6 months, but someone who is technically a doctor will be here to help you. All right. Do you have any other questions for me? You feel a sharp pain when you breathe in? When you breathe in deeply? How long has this been going on for? I see. I'm gonna say maybe just don't breathe in deeply anymore. Have you tried that? You haven't? Oh, okay, let's give that a try, and I'll see you back here, or someone will, in 6 to 8 months. Now, you play sports and you have to breathe in deeply? You're kind of old to be playing sports, you know. Sports are for kids. There's a reason we stop having recess in schools at high school. You play on an adult team? It's most of your friends? I think you need to stop. No more biting. I learn quick. You have to in this field. Okay, anything else? You have persistent waking nightmares? I will give you a referral to a psychiatric practice at the sanatorium. I know a very nice, she's not technically a doctor, but we went to med school together, who can help you out with that. Or have you tried Reiki? Reiki helped me a lot. It's energy healing. Yeah. No, they put hands on you and they start chanting. And then you feel all better. Yeah, it's real nice. Yeah, I would, waking nightmares is honestly just part of being an adult, you know? I can only do this because I'm on an illegal amount of antipsychotic medication. You think I want to be here? I have $700,000 in medical debt. I started at $900,000. And I've been working for 40 years. Your shoulder hurts a little. Alright, well, let me just give you an x-ray real quick. You might hear a little whirring as the machine turns on. I'm going to put this big coat over you. There you go. And now I'm going to leave the room. No, I wouldn't be anywhere near this machine. All right, you might hear a little whirring as I turn the machine on, okay? It might hurt. You okay in there? No, I'm fine out here. Are you okay? I see a little blood coming down your nose. Let me just wipe that. Ooh, does your neck normally do that? Oh, my bad, my bad. Um, oh my gosh, you're on the floor. Um, let's just get you back up. No, just close your eyes. Don't worry. Everything's gonna be just fine. Yeah. No. No. Don't get your phone out. Everything's perfectly fine. See? Yeah, you look perfect. You look good. Let me just wipe the blood off the floor. You gotta love this job. And your shoulder doesn't hurt anymore. Look at that. 2 birds with 1 stone. Polka dotting. Oh, you have some polka dotting. Is that what I see peeking out from your waistband? Yeah, okay. Okay, I mean, we can get you a swab, and we can have you swab that yourself. We just need you to go about 1 centimeter in, count to 5, just sing the alphabet song, and don't drop it, because then we'll have to start over. I'll leave the room. I'll come right back in. Yeah, here's your swab. If you can just go ahead and make sure to really get in there. It should hurt. Most people hate it. Knock, knock, knock. Are you done yet? Oh my god, that's your penis. Are you done yet? Okay. I could tell because you screamed. Alright. Oh, yeah. Okay. You have syphilis. Yeah, it's a nasty one. Have you been hooking up with a DL trade in the Washington, D.C. area? Yeah. It's an epidemic. I'll just go ahead and give you a short course of 28 days of antibiotics that is going to change your life forever. No, not for the better. Not for the better. And you do have to take all of them. You will experience diarrhea starting on day 3. And if all goes well, you will keep having diarrhea for the next 25 days as you continue to take these every 8 hours apart. If you miss a dose, that's no problem. But it kind of is, so don't miss a dose. Oh, and we have a patient portal. You're only going to be able to find it on the printout we give you at the end, where you're going to have to type in a URL. It's a pretty long URL. And if you don't activate your account within 24 hours, that's fine. We're just going to need you to call in and get a temporary code. And we did fire the guy that gives those out, so I would do it in the 24 hours. Otherwise, just call in, give us your name, date of birth, last name, your insurance group number, member number, because it might have changed, social security number, and then your favorite color. And that's how we'll be able to know it's really you. And then we'll give you a new code. And through that portal, you can just message me any questions you have. Any questions you have. I will charge you for some of them. But that's really the insurance's fault. Okay. Did we take care of everything? Just remember not to breathe in too deeply. And ignore the black box label on the medication I'm giving you a 6-month supply of. And these antibiotics will ruin your life. But then you won't have polka dots anymore. And you can keep sneaky linking with the DL trade. Is that all right? Did you like our first ASMR experience? Are you feeling a bit more relaxed and comfortable?